Assalamualaikum, my name is Nofatihah binti Mustafa. Today I want to demonstrate basic concept of male reproductive system and the impact of disease on health. First of all, I will draw the parts of male reproductive system. Male reproductive system, front view, the parts are on each side, the testis, the epididymis, and the vas deferens. In the middle parts, we have the urethra and the penis, and for the accessory glands, we have the prostate glands, the seminal vesicle, the Cooper glands, or the bulbourethra glands, and the last one, the scrotum. The functions of the different parts of the male reproductive system, here are the testis. The testis is also called as the testicles. Testis is a gland that produces sperm cells and male sex hormones. The male sex hormones is what we call the testosterone. Now, the functions of penis. This is the external male organ with a tip called glans. It is covered with a foreskin that may be removed through circumcisions. The functions of the scrotum, it is a pair of punch-like sac. Serves as a skin covering of the testis. It also controls the temperature because the testis must be slightly cooler than the body to produce the sperm cells. Okay, the functions of the epididymis is a narrow cold tube that stores immature sperm cells. Now, the functions of urethra, it is the passageway of both urine from the urinary bladder and the semen from the glands. The functions of the seminal vesicle, those are sac-like pouches attached to the vas deferens. It produces sugar-rich fluid that provides energy to sperm cells motility, meaning the ability of the sperm is to swim properly. Next, the functions of the vas deferens is a long muscular tube that serves as passageway of sperm cells released from the testis. It is also connects the testis to the seminal vesicles and urethra. Then, the functions of the Cooper gland, this is also called as bulbourethra glands. This is a two-piece size organ that releasing fluid that flushes out foreign matter and neutralizes the acidic urine in the urethra. The last functions of the prostate gland. This is a walnut-sized gland located between the bladder and the penis. It secretes the fluid that nourishes and protects the sperms. So there are the functions of the different parts of the male reproductive system. Now, I want to talk about disorders of the male reproductive system. So let's jump right in this first one called Balanitis. This is swelling or inflammation of the glans penis. So this occurs when a male is not circumcised and they are not retracting the foreskin and cleaning under that. So it is related to hygiene. There also may be some autoimmune disorders or diabetes and things that are causing more of these issues, but a lot of times it's just not retracting the foreskin enough and not having enough hygiene in that area that causes swelling and inflammations. Next would be benign prostatic hyperplasia or BPH for short. This is caused by an enlargement or the prostate gland not due to infection. So this just means that the prostate is becoming enlarged, and it's more common in our older male patients, those over 50. This becomes a problem because you will see the picture here. This is what a normal prostate should look like, and you will notice that the urethra runs, from the bladder down and out through the penis. And when it becomes enlarged, the prostate actually starts pushing in on that urethra or that ureter, and so it becomes more difficult for them to expel urine because of this pressure, or sometimes they are unable to completely empty their bladder due to that.